All right, as we wait, we'll go ahead and get started. Before we dive in, I wanted to acknowledge that today we'll be discussing domestic violence and intimate partner violence. We understand that this content can be difficult, and we encourage you to take care of yourself throughout the session. If you feel overwhelmed at any point, please pause, take a breath, and step away for as long as you need. Joining us for this important conversation is Dr. Waffiyah Saleem Iddriss, founder and CEO of She Matters. Dr. Waffiyah brings deep experience supporting survivors and advocating for healthier, safer outcomes for families impacted by domestic violence. Please, everyone, join me in welcoming Dr. Waffiyah.
Good afternoon, everyone. It is such a pleasure and honor to be before you all. I'm excited to share some information with you today. And so I'm going to set up my slides that will guide our conversation. And this is indeed a conversation. This is interactive, right? I'm bringing my expertise, you're bringing your expertise, and there's going to be an exchange of ideas. So let me begin to set up. Can you all see my slides?
Looking good.
You can see them? Okay,
Yep.
now okay, there we go. All righty, so we'll begin. And I will start off with saying that healing begins at home. And so this is a conversation that will be about understanding the connection between domestic violence, maternal health equity, and child welfare. As Echo shared earlier, we're really encouraging you all to practice self-care. And so before we begin, we want to acknowledge that this topic today, it can be quite heavy, right? And so as we're talking about domestic violence, intimate partner violence, and maternal health, we know that it can stir up, it can activate some emotions. And so we want you all to feel to know that it's important to take care of yourselves. And how you will do that is by simply taking a breath as you need it, right? Stepping away if this content becomes, if it becomes too heavy for you and you just need to kind of step away to break away. We're going to also encourage you all to reach out to someone you trust that you can connect with, right? To kind of process the information if need be and honor your limits. If you recognize that during this conversation, you are at capacity, right? I am at capacity. It's too much going on in my world. And you recognize that, at this moment, that this may be too much for you, we understand, right? And we also know that you don't have to share anything you're not ready to share. So we're going to honor your limits in this conversation. So if you're feeling as though, you just want to listen, listening and being present is also participation. And we just want to say that we recognize that your well-being matters in this space and beyond. So this is your invitation to take care of yourself. All right, I'm going to move to the next slide. Before we begin, we always like to ground our work in our why. And I love to acknowledge the women that have been harmed, that are going through hard times, that may have even lost their lives on behalf of domestic violence. I want to say their name, right? And so before we begin to discuss data and systems, we just want to pause and acknowledge that we're talking about human beings. This is bigger than numbers, right? Too many women, particularly Black women and marginalized women, have lost their lives to intimate partner violence, also known as IPV, while pregnant, postpartum parenting, or just attempting to survive abuse. Right now, we're just going to honor them, right? Not as statistics, not as headlines, but as mothers, daughters, sisters, caregivers, and community members. So I'm going to give you about a minute just to say the person's name. You can do it out loud, you can put it in the chat, simply saying their name, just honoring that their presence, right? That their lives matter. I will start by simply stating Deanna Stewart, who lost her life, I believe, in March 2026, was killed. She and her parents were killed by her estranged husband, who left their three children alive in the home. So I'm going to lift up her name, Deanna Stewart. Going to give us a minute to also do the same. All righty. Thank you so much. Echo, I want to share. I can't see the chat, so if you happen to see the chat, feel free to support me in that way.
Yes, someone did call out Laverne C.
All
as
righty.
someone to recognize.
Wonderful. Thank you so much. And we're holding our people high, our members high, our loved ones high. And so asking for permission to move forward with the remainder of this session. And how we will do so is really talking about and reflecting on what does safety look like and feel like for families during pregnancy and early parenting. And so I'm going to ask you all to just reflect on that. And you can also say it out loud, or you can kindly just share that in the chat. And so as you all are sharing out, because I can't necessarily see the chat, but I will say this. Hold on one second. Did anything show up in the chat?
Not to that question.
Not to the question. Okay. So typically, safety would look like, hold on one second. Safety would look like emotional safety, right? Financial stability. So oftentimes when people are experiencing this is what safety will look like if for families that are experiencing pregnancy and early parenting. Dignity. It looks like trust. It looks like healthcare access, right? It looks like rest, right? Sometimes we dismiss the notion that rest is really important. It looks like community support, and it looks like freedom from fear, right? And when we're talking about domestic violence and intimate partner violence, those things don't necessarily exist in those dynamics. And so it's really important that we lift that up and that we know that this is what people are experiencing.
We did
Yeah.
get some say support, community support, family support, empathy as all of what it looks like.
For sure. For sure. And just considering that's what it looks like for you, right? And people that experience domestic violence, um, they're not, they don't have the liberty of that those safety factors, those safety factors. So, as we're talking about domestic violence and intimate partner violence, I think it's really important to just define what it is, right? We use these words interchangeably, and there are some distinctions. Domestic violence is simply a pattern of behaviors used to gain or maintain power and control over another person with a family or household relationship. That can include spouses, intimate partners, co-parents, family members, or dating partners, right? It can also include siblings, right? And so when we're talking about intimate partner violence, we're talking about abuse or aggression in a romantic dynamic or intimate relationship. And this occurs regardless of age, race, gender identity, sexual orientation, income, religion, or educational level. And so it's really important to know that both dynamics go beyond or more than physical violence, right? It also includes emotional abuse, verbal abuse, sexual abuse, financial abuse, reproductive coercion, isolation and stalking, threats and intimidation. And now that we're so technologically advanced, now there's this inclusion of digital and technology-based abuse, right? And so these are things that we have to consider because when we're thinking about DV, which is often centering the conversation around hitting, right, around physical violence. And we want to share that it is beyond that. Folk that are experiencing IPV and DV are experiencing a range of abuse. Now, as we talk about, well, now that we've defined what DV and IPV is, let's talk about this data, right? And so, domestic violence and IPV is a phenomenon, right? And so the statistic shows 1 in 3 women are affected by or experience intimate partner violence within their lifetime. 1 in 3 women. That number is astronomical. The next number is the number one leading cause in terms of homicide among the leading cause of death, excuse me, the number one leading cause of death is during pregnancy and postpartum in the US. Okay. And so these numbers are staggering, right? IPV during pregnancy is associated with delayed prenatal care, miscarriage, preterm birth, low birth weight, maternal complications, and postpartum depression. So ultimately, what we're saying is pregnancy is a time of vulnerability, right? Not just in trying to bring forth life, but also navigating an abusive relationship, right? So you become more vulnerable to violence and coercive control. And I also want to note that Black women in New Jersey are disproportionately impacted by severe maternal morbidity, mortality, chronic stress, inequitable health care treatment, and barriers to culturally responsive care. And so, what we're really talking about underneath all of that, we're talking about structural racism, economic inequities, trauma, and violence all contribute to these staggering data. Any questions as I'm going along? All righty, we'll continue. And so now that we've defined intimate partner violence and domestic violence, and we shared what the distinction is, let's talk about some of these signs, right? And what not to do. These are some of the warning signs that one may see, right? Unexplained injuries, bruises, or frequent accidents, right? A black eye, bruises on the arm, flinching or fearfulness or startling easily, right? Wearing concealing clothing. You may see in this summertime, like today is extremely warm, right? And this weather, you may potentially see someone covered up, right? And they're not usually dressed modestly, right? But you'll just know that their clothing, you're seeing that their clothing is to cover, potentially covering up or concealing injuries, right? Behavioral and emotional signs, withdrawal from friends. They become isolated, right? They're no longer hanging out. The partner speaks for them. You'll notice that they may lose their voice. There's control over their phone and money. They don't have access to their money, right? Anxiety, depression, low self-esteem, or hopelessness, right? This type of abusive behavior, it takes a toll on your mental health. It may show up as missing appointments, especially if you have prenatal visits, right? The partner is overtly controlling, jealous, or monitoring, right? During pregnancy, it may look like late or inconsistent prenatal care, right? These are red flags. Partner insists or attending all appointments, right? And so sometimes you say, "Oh, they're so helpful. Look at you. Your partner is there all the time." But it just may also be an indication of control, right? A way so to make sure that you're not sharing what's happening at home, right? You may also see signs of fear or shame or reluctance to speak freely. These are things to look out for, right? And so these are some signs that you may want to just be mindful of, right? And what I also want to talk about is what not to do. This is so incredibly important when we're talking about domestic violence. It's really important that we acknowledge that those that are in those environments or those dynamics, they are the expert of their relationship, of their situation, of their experience, right? And so one of the things we fail at oftentimes, and although it may come from a place of good intentions, of really wanting to support, but don't ask, why don't you just leave? That is a question that we need to just release, right? Because leaving is the most dangerous time, is the most dangerous time, right? And what do we mean by that? It is during the time that they try to leave is where the homicide actually happens. Okay. Don't confront the abuser. This can escalate danger. Don't share what they told with you without their permission, right? And sometimes you're thinking you're helping, right? But you need to ask for permission. Is it okay for me to share this right now? Right? They just might be venting with you, right? You might be the first person that they can trust that they can get this out, but it may not be the time to actually begin sharing this out without a safety plan. All right. Don't pressure them to make decisions before they're ready. Right. Sometimes we can be kind of judgy, right? Oh, you're in a domestic violence, intimate partner violence situation. You need to leave. Get out of there. Right. And we put the pressure on them. But the thing is to not do that. Don't pressure them to make decisions before they're ready. They may not be ready. And the truth is that they love their partner. They don't love the abuse. right? Don't minimize or dismiss what they share, right? So you're taking it in, you're not minimizing it, but you're not jumping the gun and doing something with the information before permission. And you're absolutely not compromising confidentiality. Why do we say that? If you're a mandated reporter, and most of us are, you can't promise absolute confidentiality, right? And so I think it's important to say that in the beginning of the conversation. Like, listen, this is my role. This is what I do. I am a mandatory reporter. So if you share with me as my role, I do have to share out. So you do have to share, you have to provide that information just so that they're clear, so that they have that you're allowing them to stand in their choices, right? What you can do instead, right? You can listen without judgment. Listen without judgment. Believe them. That's so incredibly important. And simply ask the question, are you safe? Right? Safety is relative, but we get to ask, are you safe? Right? And then have them define what is safety for you? How can I support you? Offer resources. Don't force them, right? Offer resources. Follow their lead and respect their timeline. I know when we hear someone shares with us that they're in an abusive relationship, you need to get out of there immediately. Go now. I'll help you now. You have to respect their timeline. Oftentimes, there's a safety plan that's in place, right? They're thinking about their children. They're thinking about their economic status. There's a lot of things that goes into this dynamic. And so it's not a one and done, and it's not an immediate reaction. Oftentimes, it's planned, right? It's coordinated. Connect them to a trained domestic violence advocate. And at the end of this session, I'll share with you some resources that you can tap into that can support you or someone you know that is experiencing this. So we need to know that safety planning should always be led by the survivor. Your role is to support, not to rescue. Why do we say that? We talked about domestic violence and involving power and control. And so when we're talking about survivors, it's always incredibly important that they stand in control, that they recognize that they have the power to choose. You want to support that dynamic. That's a part of supporting them. That's a part of the healing process, right? That's a part of them being empowered again. Any questions? Now we're going to transition this conversation into the intersection, right? What are we talking about? Domestic violence, maternal health equity, and child welfare, they intersect. In fact, they overlap. And I want you to know that none of these operate in isolation. They are deeply interconnected systems that shape safety, health, and the futures of families, right? And what does that mean? When we're responding to them, it's important that we respond with a greater compassion, coordination, and effectiveness. If you are not an expert in this space, it's really important to tag other people in. It's nothing wrong with having a pipeline, right? Each person has their role. And when you're outside of your scope, tag someone in, right? My scope in this situation is I bring awareness. I'm a translator. I'm able to translate information. I'm also can be a bridge and loop people into resources that can further support them, right? And as we talk about intersection, domestic violence is centered around power and control, fear, trauma, and isolation. This is how it thrives. When we're talking about maternal health equity, we're talking about prenatal, postpartum care. There's some racial disparities. We talked about Black women being more vulnerable, right? Marginalized communities being more vulnerable. We're talking about reproductive coercion, and we're talking about birth outcomes. And then we're talking about child welfare, which impacts the developmental, family separation, toxic stress, and system involvement. How do these all interconnect? They interconnect with the family, the safety of the family, and the thriving of the family. And so it's so incredibly important to know that your work is not isolated. If you're in the maternal health equity space, you're talking about access, but you're also talking about family safety and healing, right? If you're in a domestic violence, you're talking about power and control. And you're also talking about crime because DV is a crime, but it's also still centered in family. Child welfare is still centered in family, right? And so we're talking about violence that shapes health. Intimate partner violence during pregnancy increases risk of preterm birth, low birth weight, and maternal mortality, especially for Black women, right? You're starting to see some themes here, right? You're starting to see racism, some systems inequities are intertwined into these different dynamics. Health inequity enables harm. Systemic racism and lack of culturally responsive care leaves survivors without safe options, right? Perpetuating cycles of abuse, right? And then we're talking about children. Children are always affected, whether it's domestic violence or maternal health equity and child welfare. Even without direct physical exposure, children in homes where violence is present, toxic stress is definitely is present that profoundly shapes the development of children. And so, as you can see, these different dynamics, they overlap. They're absolutely impacting and affecting our children, causing harm and shaping health outcomes. And so, without addressing one without the others, leave the families incomplete in their healing. And so, the encouragement is a whole family trauma informed approach is essential. So, when you are involved in families, you're asking, what has happened to you? So now we're going to talk a little bit about the communities that are experiencing heightened vulnerability. We already provided the statistics. 1 in 4 women are affected by intimate partner violence. Latina women are 43% will experience IPV in their lifetime, right? Indigenous women are two times more than a national rate to experience intimate partner violence, right? Then we're talking about the LGBTQIA community, right? And individuals. 1 in 3, in comparison to 1 in 4 heterosexual women, will experience IPV. Now, when we're talking about Black women again, they are 2 to 3 times more likely than white women to face higher rates of fatal violence, right? What does this mean? Black and Indigenous women are facing compounded structural and systemic inequities, right? They have that intersectionality, right? LGBTQIA, stigma and lack of affirming spaces. This is create gaps of why they haven't been able to receive support, right? Or resources. Latina and immigrant communities, language barriers and immigration fears limit access, right? And so we know that now that we're dealing with a lot of immigration challenges, we know that that is also going to be a barrier for them to get access to support. And we fail sometimes to even think about young parents, particularly families that are navigating poverty. This is include adolescents, right? They're also survivors. The statistic shows, I don't have it listed here, but the statistic shows that 1 in 12 young people that are in relationships will experience intimate partner violence. 1 in 12. So this isn't just a situation with adults. Our young people are also impacted by this dynamic. So now we're going to talk a little bit more about mental health, child development, and child welfare. The impact that this is having on mothers and caregivers can cause anxiety. We mentioned that already. Depression, post-traumatic stress disorder, chronic stress, panic attacks, sleep disturbances, or suicidal ideation, and substance use are often used as coping response, right? The child welfare intersection, survivors are often losing custody, right? Although they should not. I used to work for a DCP&P, and so there's a special way that you handle families that are experiencing domestic violence, right? We know we it is understood that you don't penalize the non-offending parent by removing parent by removing children because there's violence in the home. There's a special way that you handle domestic violence, right? Child welfare involvement, being blamed or retaliation, causing many to avoid seeking help, right? Fearing that the system will punish rather than support. And so that may be a reason why, excuse me, a family member or non-offending parent may kind of push away from wanting to be involved in child welfare, right? And how does this impact our babies and young children? Exposure to violence and chronic stress affects brain development, attachment, emotional regulation, language, sleep, behavior, and learning readiness, right? Toxic stress is simply prolonged adversity without protective support, which contributes to developmental delays, anxiety, hypervigilance, and emotional dysregulation. So children do not have to directly witness violence to be impacted. So oftentimes, I know when I used to work for CPS, right? It's like, well, the children didn't directly see their mother or whomever was harmed get hit, But if they're aware of the violence in the home, they take on that stress and it impacts how they learn, it impacts how they relate, it impacts their brain development, right? How they're able to even regulate their own emotions, how they attach. And so these are all the things that we get to consider. I want to share ACNJ is working on midwifery, right? How do we support the role of doulas and midwives? And this is how we get to support and tap in to the role of what ACNJ is doing to really push the inclusion of midwives, right? Because doulas and midwives are trusted support who spend a significant amount of time with families during pregnancy, birth, and postpartum. And those relationship-centered approaches allow them to see those warning signs that some of us may miss from just having one appointment, right? It is through the relationship building that you'll begin to see signs and develop rapports with families so that they can actually access support, right? So it's through those safe and trusting relationships, it can reduce isolation. It also provides an opportunity for affirming, right? And also able to access closely responsive support and resources, right? And also validate the survivor's experience. That's so incredibly important that we validate the survivor's experience. Early identification, noticing fearfulness, controlling behaviors, right? They can look at those missed appointments, unexplained injuries, right? Signs of coercion, then connecting families to DV services, mental health support, and legal advocacy. So they will oftentimes they act as a bridge for support and resources and as a support to navigate safety planning, right? Through the healthcare systems, encouraging informed decision making, advocating for respectful care, and reducing the fear and shame during disclosure. And so this is the role that doulas and midwives play as it relates to domestic violence, intimate partner violence during that maternal journey, right? Prenatal and postpartum visits are critical opportunities for IPV screening, safety planning, mental health support, referrals, and early intervention. So that's important to note. What can you do, right? There's a call to action. I know that here today we have parents, caregivers on at this webinar, community partners, advocates, and leaders, right? So change begins with each of us. It's not just on the family that's experiencing it, right? All of us play a role in keeping the community safe. What does that look like for parents and caregivers? It looks like knowing the signs of IPV and trusting your instincts, like, something doesn't seem completely all the way there. Let me explore a little bit, right? Reach out to a hotline or trusted provider, right? It also creates safety plans for yourself and your children. Connect with community doulas, midwives, and peer supporters. Knowing your rights. You deserve safety, dignity, and support. Community partners, what does that look like? Screening IPV in prenatal, postpartum, and pediatric settings, right? Being trauma informed, culturally responsive practices, right? Partnering with DV organizations. We have a national, a statewide DV organization, New Jersey Coalition to End Domestic Violence, which is kind of like a resource hub where you can tap into all the different, excuse me, organizations that are addressing domestic violence and intimate partner violence. They actually also have they have a group where it's culturally specific. So there are organizations that are culturally specific, where people can get culturally responsive care. Remove barriers to care, such as language, transportation, fear of systems. Advocate for policies that protect and support survivors, right? Advocates and leaders center the voices of survivors, believe survivors, particularly Black, Indigenous, and marginalized women. Believe them. That's the first step. Push for systemic change in child welfare, healthcare, and housing. Fund community-based organizations doing this work. Funding is incredibly important. Challenge policies that punish survivors. Speak up, show up, and stay accountable. There was one recent act that was the Survivors Justice Act. And so that's really supporting women that were incarcerated, right? And oftentimes the incarceration was connected to their trauma, domestic violence, right? Intimate partner violence. And so that act really supports them in saying, listen, right? We understand the cycle of violence. We understand that there was some protection that was happening, that was involved. There was some trauma involved in terms of how you landed where you are. And so these are things to consider. These are things to support, right? And get behind. And we want you to know that every action, big or small, moves us closer to a world where family is safe, right? These are the resources that I mentioned. Domestic New Jersey Coalition to End Domestic Violence. I'm also a part of that organization. I am the co-chair for Women of Color Task Force. I work directly with the culturally specific organizations that are addressing domestic violence and sexual violence. There's also New Jersey Domestic Violence Hotline, which you can tap into. There's a phone number that's here. My business, She Matters, right? I created a healing and liberation curriculum, really support survivors that are navigating gender-based violence. Then you have the maternal health resources, Nurture New Jersey, Black Mamas Matter Alliance, who actually created Black Maternal Health Week, right? And then you have COCNJ, Connecting Our Communities for New Jersey, right? What supports advocacy. It's a resource hope hub and people to policy pipeline. Now we're going to engage in a conversation. Now that I've shared all that information, right? Want to talk about closing reflection and affirmation. Okay. What does it look like for our communities to move beyond crisis response and truly support family, safety, mental wellness, and healing? And so if you can share out in the chat, what do you think? What does it look like for us to support our communities beyond crisis? Echo, if there's anything in the chat, please let me know.
I will. I think nothing yet. Oh, link to support services.
Absolutely. Link to support services for sure. Oftentimes our families, we talked about the stigma, we talked about the shame. And so families are navigating those feelings, which can be a barrier to accessing support and resources. So it's important to offer resources, right?
Someone put housing supports after leaving a situation, closing the gender pay gap, following up and following through, community involvement, safe houses, mental resources, and helping people, helping when we are able to while still having our own boundaries.
For sure, while still having your own boundaries. Yes. Yes. And housing is a big one. Excuse me. The work that I'm doing with New Jersey Coalition to End Domestic Violence, we know that housing is huge. And so, especially when we're asking people, when we're suggesting, although we said that we shouldn't do that, but when we're saying people to leave, to go where? To go where, right? And so we know that there's the power and control dynamic. And so there's that financial control, right? And so when we're talking about really supporting individuals that are experiencing this level of abuse, housing is critical, right? So if they're going to leave, where do they go? It's important that we have housing available. It's important that we give them access to finances, right? It's important we believe what is happening, right, when they're sharing. It's also important to know that they may not necessarily be ready to leave at the moment that they share out.
We had a couple other comments. Someone said maintaining confidentiality while providing support to victims. Someone mentioned being kind, providing hope, and truly protecting women, believing them initially, and holding those who are abusive accountable. And then education and job training.
For sure, education and job training, for sure. And I want to say this too. The healing process for family is not to just focus on the survivors, but it's really important to provide resources and support to the batterers, right? And so when we're talking about the family dynamic, right? Yes, we want to get support to the person who's been primarily victimized, right? And we also want to provide support to the batterers, right? We want to disrupt those abusive behaviors. And so it's important to link them to resources as well,
Going off that, somebody put support with empathy and without judgment.
for sure. And engaging our men in these conversations, right? In the conversations, leading the way. It's really important that men are also walking alongside of us in this conversation. I know we recently had a meeting and we talked about the involvement of men, We need men to also lead this conversation, to be in the forefront and speaking to other men about domestic violence and intimate partner violence. And so we
And
will
some,
all go ahead. We're gonna
oh,
say
sorry, someone mentioned that men are also impacted by violence.
for sure, for sure. They're victimized as well, for sure, for sure. And so, what we're talking about in our reflection is we're talking about safety and dignity. Every family deserves more than survival. And when we're talking and bringing awareness to domestic violence, maternal health equity, we're talking about the access to thriving, the access to joy, right? And we're talking about early intervention. We know that healthy beginnings require communities willing to intervene early and respond compassionately. Intervention is incredibly important, right? We talked about our children are impacted, right? We're talking about collective care, systems rooted in care, not harm, making healing possible. And so, what does that mean? Being culturally responsive, right? We talked about the statistics for Latinas that are impacted by intimate partner violence, Black women that are impacted by domestic violence. Culturally responsive care is incredibly important, right? What does that look like? It looks like translation, language accessibility, not just necessarily bilingual, but also making the language accessible where they understand it, right? Recognizing learning differentiations, recognizing, right, uh, simplifying the language so that it's accessible to the average person. And
Someone
also,
commented that it truly takes a village.
for sure, it takes a village. We cannot do this alone, right? Although healing begins at home, it is collective care that makes healing possible. I'm going to open it up now. I guess I can stop the share and just any questions for anyone.